drainage system in the eye goes 360-degree around. And if you compare this to, let's say, your kitchen sink, there's a strainer in the sink, and it has openings, and this can obstruct over time. And something similar appears to be going on in glaucoma. Now, if you imagine an instrument that could remove the strainer in there, then you would have free flow, a free connection to the outflow system, to the plumbing, essentially. Same with the eye. We remove the resistance, and there's free flow without much flow resistance into this drainage system of the eye. And that is the advantage, that we are not leaving any scars in the conjunctiva, and that it's a fairly minimally invasive procedure with a good risk. Classical glaucoma surgery creates a large wound area underneath the upper eyelid and creates a fluid pocket underneath the conjunctiva. And essentially, if you can believe this, we're putting a hole in the eye and allowing the flow from the front of the eye to drain underneath the conjunctiva. That's trabeculectomy, the classical glaucoma surgery. Now, as your body tries to heal up that hole, scar tissue will contract and compress this bleb, the filtration area. And that always causes this failure rate that I mentioned. That's approximately 50% maybe in 5 years or so. The new procedure that we offer here at Yale is, for advanced glaucoma, is called the suprachoroidal shunt. And this creates no scars and no fluid pockets underneath the conjunctiva. It shunts fluid into a previously unutilized space, the suprachoroidal space. So from the front of the eye towards the space underneath the retina, the suprachoroidal space. And that's called the gold shunt. This is still an investigational device in the United States, but it's been used in Europe for 5 years. It is available in Canada already, and has been first, I think, implanted in Israel with very good long-term results. This is the suprachoroidal shunt, a gold shunt. It's a third-generation device that allows to shunt fluid from the front of the eye into a potential space with a huge drainage capacity that is on the inside of the eye, and that means that there is a much reduced risk of an infection long-term and short-term, because you don't have this bleb of the classical trabeculectomy. Very good for advanced glaucoma, but we only offer it to select patients who have had a prior failed surgery. These are the inclusion criteria for that, and oftentimes these are the people who are the most desperate. Almost everyone gets scar formation of the bleb, and as 50% fail over about 5 years, this is an incredible solution that avoids the large incision and the meticulous aftercare that a trabeculectomy requires. No postoperative injections, no anti-scarring medications, and much less office visits for it.